So Rob, I see from your chief complaint that you filled out that you've had a sore throat for several days. Tell me a little bit about what's going on.
This is a virtual medical appointment with a Cone Health doctor through MDLIVE's secure telehealth platform. The patient, Robert, is in his office. He scheduled an appointment with a board-certified Cone Health physician conducted through a computer connection. In addition to a sore throat, Robert has ear pain. He shows Dr. John Jenkins where it hurts the most. Dr. Jenkins diagnosed Robert with an infection. Robert was told to go home because he's contagious and to pick up a prescription. An efficient, seamless, time-saving routine virtual visit made possible thanks to a unique partnership with Cone Health and MDLIVE.
We needed to find a partner that would help us have speed to market and also create a Cone experience for our customers.
Cone Health is a growing nonprofit healthcare system serving the Greensboro, North Carolina region. The team here wanted more than just a vendor to provide a digital healthcare system and achieve a top-tier telehealth service.
With MDLIVE, we felt there was an excellent cultural fit because they were willing to create the Cone-branded experience that we needed, and they were willing to be a partner in innovation.
What the Cone Health team got from MDLIVE was much more.
It's one team working for the best for our patients. We've actually gotten to be pretty good friends with folks there and feel their support.
They've become part of our family, so to speak. They've been wonderful. They have been here on site at any time we needed.
The partnership grew stronger after MDLIVE fulfilled Cone Health's extensive telehealth wish list. It included seamless integration with its computer systems, including the patient portal MyChart and the medical records platform Epic.
So when Cone Health said we want to try to integrate video visits within our Epic platform, which hasn't successfully been done across the nation with MDLIVE, they were willing to let us be the alpha site and to test this theory that we could integrate it through MyChart and do scheduled visits.
The goal? A virtual health platform that's familiar in the clinic.
When the provider launches MDLIVE in Epic, it will show them the same type of documentation that they're used to doing in the office, which has been really helpful.
And easy for patients.
They just go into MyChart and go ahead and schedule their own appointment for the video visit. Well, the camera comes on for the patient and it shows in Epic that the patient has arrived, and we have the patient on one screen and Epic to document it on the other screen, Cone Health link.
Cone Health first introduced the telehealth system to its 11,000 employees.
We got numerous stories from our employees of how a telehealth visit may have saved a vacation or may have made a Saturday more functional for a family because they could do a telehealth visit rather than wait for 6 hours in an urgent care when their kid had an ear infection.
When the telehealth program was introduced to the patient population by MDLIVE, it had to be under Cone Health's Connected Care brand.
Our name speaks quality, so we knew that if we could find a vendor that would label it and brand it as a Cone experience, it would provide a comfort for this new technology.
Telehealth is a huge convenience to Cone Health's cancer patients recovering at home.
We're able to provide access for patients who are undergoing chemotherapy and radiation therapy, and they already feel like they don't want to get dressed and drive into the hospital. So being able to have a conversation with a provider and to get a plan together for their symptoms from the convenience of their home when you're in this kind of a battle is huge.
One patient with breast cancer developed severe cellulitis on her arm. Telehealth made a difference.
Whenever you have that severe of a cellulitis, we do need to keep constant checks on her. So she would move the camera and show me her entire length of her arm. It was very easy to see and know that it was slowly improving.
Medicare patients can also benefit from the MDLIVE Cone Health platform. Patients can schedule annual wellness visits and checkups through telehealth.
I think the advantages are endless. People that struggle to find a ride, now they can log on the computer and have the same visit, same 45 minutes, still with face-to-face with their provider or with the RN, and still get that same level of care that they would get if they were in the office.
MDLIVE helped Cone Health solve an urgent challenge: underserved rural patients who temporarily lost their local healthcare providers.
We partnered with MDLIVE to create a co-branded landing page and allowed our MDLIVE partner physicians and the Cone Health physicians who are on the MDLIVE platform to provide care to those clinic patients. So when you talk about the mission of healthcare, that's huge.
MDLIVE will be stepping in to help Cone Health develop telehealth pediatric care to school nurses.
MDLIVE has always been receptive to these ideas and actually been excited about helping us to develop and deploy these ideas.
The ideas do not end here. From telehealth's growth in popularity among patients to the efficiencies it brings to the clinic, this MDLIVE Cone Health partnership is looking to the future.
I think there's a huge population that would love to have a video visit with their provider rather than coming into the office.
The future with MDLIVE is, I think, bright because the nature of our partnership allows us to innovate in several areas of care.
They're very open-minded and love to think outside of the box, so I think we entertain them with our ideas.